the rate of growth day over day has stabilized, with the outbreak of this virus having likely peaked in the community. And we are trending toward a best case scenario rather than a worst case scenario.
Physical distancing measures are working, according to the province, but health officials say we're not out of the woods yet. Dozens of people are now being treated at Windsor's Field Hospital. We'll hear from the daughter of a 92-year-old woman in one of those beds. She was one of the first to move into the space. I'm Chris Ensing. Thanks for joining us. Community spread of COVID-19 appears to have peaked earlier than expected, but public health officials say that they don't expect to ease restrictions yet. The big issue continues to be long-term care and retirement homes. It's a story that's playing out across the country, and especially here in Windsor, Essex. 6 more people died this weekend, each a resident of a long-term care or retirement home. 4 were women ranging in ages of 60s to 90s. 2 men also died, one in his 80s, another in his 90s. In total, 27 people have died of COVID-19, and 20 of those deaths are linked to long-term care or retirement homes, according to the health unit. The number of confirmed cases, it continues to rise here. 482 positive tests as of today, with 80 people having recovered from the coronavirus in Windsor, Essex. The number of people waiting on test results, it's also gone up, but so is testing. The health unit did more than 1,500 tests in the last 7 days as the battle shifts to our seniors in long-term care facilities. Now, some of those seniors are about to spend weeks at the St. Clair College Field Hospital. We gave you a tour of the 100-bed facility on Friday. People living at long-term care retirement homes who have COVID were moved there this weekend. Amy Dodge now with a look at what that kind of move is like.
We spoke with Charmaine Edwards. Her mother is 92. She was one of the first people who moved to the field hospital from Heron Terrace. We reached her in BC today. She says when they watched the CBC's tour of the field hospital on Friday, it was overwhelming, but it really reassured her that this is exactly where her mom needs to be.
You know right away that everybody did their very best to make this place a place for people like my mom who can heal from COVID-19, and that they would be getting the very best medical care, I think, in the world.
Heron Terrace moved 28 of its residents to the field hospital. John Scotland is the CEO of the home. He says the main issue for them right now is staffing. He says they usually have 90 care staff, and now they only have 30. Shifting residents to the hospital helped address some of those problems.
So for us, it was what's in the best interest of our residents? Where can we be assured they will get the care they need? And it wasn't hard to make that decision.
What was a challenging decision for Scotland was around patients with dementia and whether they should be moved. This is a question that was also raised by critics on Twitter, including Dr. Samir Sinha with Sinai Health System in Toronto. He was concerned the stark white walls and bright lights in a field hospital might traumatize dementia